Hi everybody, my name is Jenny Sprung and I'm a neurosomatic massage therapist and a zero balancer. I do myofascial release. I also do trigger point release. I do temporomandibular joint release, viscera. All of my credentials are on my website, treatyourselfnaturally.com. I built this website to be a do-it-yourself pain relief resource guide so that you can, check out a few of the articles that are associated with the videos and see if any of it works for you to reduce pain, increase range of motion, increase energy flow, and generally feel much better. So today we're going to start with temporomandibular joint. If you have a head forward position, if you grind, pop, or click, if you have trouble opening or trouble going side to side, look in a mirror. Do you have asymmetry? Is one eye closed, one eye open, one ear higher, one ear lower? Is your jaw crooked? Headaches, clenching, grinding, trauma, dental work, whiplash, shoulder pain, head, neck pain, it can all lead to TMJD, temporomandibular joint dysfunction. So we're going to review this today. I would like you to do this lying down, but for purposes of the video, I'm going to do this seated. The first thing I'd like you to do is we're going to work external, and then you're going to find a pair of surgical gloves, and we'll do some beginner internal. This is beginner, simple, easy release of the jaw. First, I'd like you to do some neck exercises. So do a little bobblehead and a little Egyptian ear to shoulder. Open the jaw, each side. Turn the head left and right. Ear to shoulder again. You can look up a little bit and look down a little bit. Roll the shoulders back and forth. Maybe open up the back a little bit. Reach all the way up and reach behind you and stretch out the chest. Nice. Next, you'll find a mirror and do jaw exercises. So I'd like you to open and close the jaw. I have run into folks who've got a lot of pain, and this is a very, very tender, full of emotion, intense area. So be gentle. Tune in and connect and breathe while you work your temporomandibular joint. Open and close. Open and close. See what you feel all through here. Go left and right with the mandible. It's called lateral protrusion. Left and right. You can even do a number 8. So it's going to be and back up. It's hard for me not to do it without a mirror. You want to look in a mirror because otherwise you'll be going all over the place. You can do infinity. And these simple exercises, opening and closing, they all will help with the jaw. The next that I'd like you to do is the platysma. We'll start right here at the jawbone. Here's your zygoma, your cheekbone. Start at the jawbone and just roll the skin along the platysma. Grab the skin and roll it all the way down to the collarbone, to the clavicle. Both sides. So you'll grab the skin and just roll it. And you'll find this can be stingy. So go easy. If it hurts too much, come out of it. But come back to it. We want to generate warmth in the fascia. That will increase range of motion, increase space. You'll feel so much better with this soft. And you can even just spread, gather, scoop the fascia all below the jaw. Reach up and do your temporalis. This is also reviewed in the head, cranium and eye. Temporalis, and there's an article associated with this that gives you photographs and a tiny bit of anatomy. This is not an anatomy class. This is for you to release jaw pain, head pain, neck pain, for you to be empowered to make those changes. So the temporalis, it's all around here. It's a very large muscle. Ooh. Find a spot. Breathe in. Exhale out twice as long as your inhale. 8 to 12 seconds. Hold the spot and release. 2 to 3 pounds of pressure. Not too much. Just enough to affect change. You want to just release the temporalis. Pull up. You can also do hair pulling, opening the jaw. You can work the masseter externally for the zygoma, all the way down to the mandible, and then up from the mandible, all the way up to the zygoma. The masseter has a deep structure, and it has a superficial structure. You can feel them, you'll roll right over them. You want to do that. You can also pull down and open the jaw, pull up and stretch the fascia, and take it all the way up to the temples and up to the head, and then from there you can squeeze and open the jaw. Lovely. You can go underneath the jaw and just place your hands, fingers, or you can just pinch and pull. This is going to be tender in here. You don't go deep. We're just stretching the skin, warming up the fascia. So many reasons. Have you ever stood behind someone and seen their jaw clenching, bruxing, grinding? Tension, stress, computer work, head forward position, handhelds, they all create jaw pain. If you have a shoulder injury, it can go up into your jaw, and the jaw pain can go down in your shoulder. Very important to release this area. Once again, when you find a tender spot, if it's too tender, get out of there. But if it's tender and you feel it softening and releasing, that's what you want. So now, surgical gloves, any type of glove from any drugstore. You can do this in the shower without gloves, but for safety and sanitary purposes, place on your surgical gloves. And the very first thing I want you to do internally is to just go in and rub your gums. Now, so many muscles inside the mouth. So massage your gums. You'll be on the outside, which is the buccal side. I don't want you to go inside the lingual side. Don't do that. That's for a more intermediate or more advanced segment of treatyourselfnaturally.com. For now, we're starting beginner, simple, easy. Just rub your gums. Rub out the gums. And then start to push the lower orbicularis down. Orbicularis oris, the muscle around the mouth. It's a muscle that purses the lips, that kisses. So go in and just work it. You can do it like this. Okay, and there's a sore spot. Oh, very tender. When you run into a very tender spot, hold it and breathe and relax into it. So all around them, all up, and you can just push way up underneath your nose. It kind of looks funny, doesn't it? But it really works. So good. Now here's a spot that's real sore. Ah, tender, tender, tender. The jaw can be stingy. If it doesn't release in 8 to 12 seconds, get out of there, take a break, and come back to it another day. Eventually it will release. We're not using harsh pressure. 2 to 3 pounds of pressure. Ah, very nice. Excellent, excellent. So now you'll just go in with your thumb and just squeeze the cheek. And what I'm doing is I'm just going like this. Got it? Squeeze the lips. And squeeze the cheek. Oh, there's a spot over here. Again, 2 to 3 big breaths. Inhale and double the exhale time. 8 to 12 seconds. You can go up into the cheek even more. And this is for all my friends. Laurel, for you, for everyone. Go in and see if you can open up all of the muscles inside the mouth. Oh. Oh. So inside the cheek, inside the gums, the orbicularis oris, there's an article on my website that accompanies this that will show you the landmarks and show you the muscles, show you these structures. Next, I'd like you to do the masseter. And this is the clenching. This is a huge clencher. So you're going to take your left hand and hold it on the outside of your left cheek. You're going to turn your hand like this and take the right pointer finger and go in. Outside of the teeth, right here, and just go up underneath the cheekbone, underneath the zygoma. You'll feel it with this hand, and just press the hands together gently. That's it. And you do a sandwich all the way down the masseter. There actually will be a lot of liquid that will come out, so have a Kleenex near. That's why doing this in the shower is great. So you can go in and scoop with the finger inside if you'd like. We'll do the other side. Again, right hand on right cheek, left pointer in. On the outside of the teeth, between the cheek and the gums, and just hold that and squeeze it together. So you're doing this. Okay. All the way down. And you're like, so, oh, where do I go? Your mandible is here. Your jawbone, your cheekbone. The masseter runs between the zygoma, the cheekbone, and the mandible, just in between there. It's wonderful. 2 more points that I really would like you to try. Again, same position, left hand on left cheek, right finger this way. So I'm not going this way, I'm going this way. So my palm is facing the fatty part of the finger is going towards the palm of the other hand. You're going to go up between the molars in the back and the cheekbone. Way up in here. So right up here. And then open and close the jaw gently. And you can even pull. So you reach in like this. Pull it out. And that's a pterygoid. And that is an opener. And so on the outside of the molars, up. Outside molars and up right here. And just push towards the outside hand. You push towards that outside hand. The last one, and it's a fun one. The tongue. It's a muscle. It's a muscle. And sometimes we hold our tongue. We don't want to hurt someone's feelings, or we say too much and we wish we hadn't. Sometimes the tongue gets stuck, sore, tight. So you're going to use your gloves and you're going to squeeze your tongue. And run your fingers along the outside edge. And just come off. So you're going to reach in. Squeeze and come off. You would be so surprised at how many trigger points there are in the tongue. You can grab the tongue and press it like this. Ah. And yes, there will be some drooling. It's okay. The idea is to release the tongue. So once again, reaching in. You don't want to gag. You don't want to pull the tongue too much. You can pull it a little bit, but be gentle. But you squeeze it. Each time I do it, it feels better. And the same principle applies, 8 to 12 seconds, 2 to 3 deep breaths. You can feel the tongue release in the back of the neck, the back of the head. I highly recommend it. Don't be afraid. And there's nothing weird about it. It's a muscle. We use it all the time to speak, to chew. I imagine our tongues move around in our mouths all night long while we're dreaming. Thank you very much. I appreciate you tuning in. Please come visit my website for other fun stuff and interesting tidbits of how to do it yourself and treat yourself naturally. Pain relief. Jenny Sprung. Thank you very much. Goodbye.